Hi, I'm Vera Franklin with Word Out Ministry, where our focus is to get the word out to the public regarding beneficial information for the body of Christ and our community. This is a Big Down production. You can catch our live stream on the following platforms: Apple TV, Roku TV, YouTube, Facebook Live, KMI 2024 ORG, Cross TV, the Apple iPhone app, and the Android app. You can also watch us on KMI USA app and on YouTube on the Jerry Green channel. Now, today I'd like to welcome you and introduce my guest for today, Ted Brooks Jr. Welcome to the show today, Ted.
Pleasure to be here.
How are you today?
Wonderful. Absolutely wonderful. It's getting a little chilly, but it's the time. We live in Connecticut, so yeah, still doing wonderful.
Well, thank you so much for coming to our show. Now, I know that many of us are familiar with what happens at the end of this month. October, you see the signs on TV, the commercials, you hear them on the radio, the ads stating that it's that time of year.
Yes.
That time to renew your Medicare plan.
Mm-hmm.
You know, for those of us that don't know this, but Medicare affects approximately 19% of the United States. And that's around 66 million individuals on Medicare. Now, Ted Brooks today, Jr., is the expert on Medicare. How do I know? I'll tell you later. But I'm going to ask him, Ted, can you explain to us what Medicare is?
Medicare is the governmental assistance for health care for those who are age 65 and older. You have to be age 65, at which point you pick up automatically Part A. You have to apply, though, for Part B. What that means is for those who are still working at the age of 65 and have coverage through their jobs, they can continue to have that coverage, but they'll automatically get Part A, but they don't have to turn on Part B. Once they turn on Part B, then they're eligible for the Medicare system, which is, again, the governmental health insurance portion.
Okay, you just said Part A, Part B. So, of course, many of us are confused every year. If you reach that age, you're like, you have to go and do this and do that, make sure this is that way, that is that way. So, what qualifies a person to receive Medicare, and why is it so confusing?
Well, it's confusing because the government's involved, but y'all didn't hear me say that. Medicare is, for those who qualify, again, you have to be age 65.
Mm-hmm.
Now, there's two sides of Medicare. There's Medicare and then there's Medicaid. Medicaid is assistance from the government for those who may or may not be able to afford their Medicare portions of expenses. So Medicaid is usually for those who have what's called the little gray card. They're on governmental assistance, and they get extra, what's called extra help to alleviate some of the expenses that are associated with Medicare. So Medicaid is one side, Medicare is the other. Medicare, you have to be 65 or older. Medicaid, you have to have a certain level of income, and you also have to, in some cases, if you are under the age 65 but you are disabled, you are eligible for Medicaid.
Okay.
But for the most part, Medicare is for people, those who are 65 or older.
Okay. So when a person qualifies for that, so I could be transitioning from my place of employment.
Mm-hmm.
I've turned 65 and I opted not to continue to work.
Mm-hmm.
I've if I had whatever circumstances, now it's time for me to decide how I'm going to get my health care taken care of with
Mm-hmm.
Medicare. So how do I enroll?
Well, as I mentioned earlier, you automatically receive Part A just for being 65 years old. And then you are eligible for Part B to sign up for it. There are certain different periods for enrollment. So the enrollment that we're all familiar with is from
Mhm.
October 15th to December 7th, which is annual enrollment period.
Okay.
Anybody, everybody can make moves, come in, go out. You can change whatever plan you want. The other is called the special election period, which usually signifies either you move to another part of the state or another part of the country, or the plan has been discontinued in your area, which is going on right now,
Okay.
or you have some other special circumstances, such as you're leaving your job. I'm now retired and I'm going from my regular job, health insurance, to now Medicare. That's a special election period. You have also what's called an initial election period. That's when someone turns 65. Now it gets a
Mm.
little strange here, so let me explain and go slow.
Okay.
When you first turn 65, what year are you born? What month are you born?
November.
November. Okay, so for give you as an example,
Thank you.
you're born in the month of November. You have August, September, October, the month of November, December, January, February. You have a 7-month period to make a choice to come on to Medicare when you turn 65. So you get 3 months before your 65th birthday,
Hmm.
the month of your 65th birthday, and 3 months after that. That's what's called your initial election period. You can
Okay.
make any choice you want. You got a whole 7 months to make that choice to come in or stay out of. If you elect to not make the change, you can stay where you are as long as you have what's called credible coverage. The government wants credible coverage. They define that as coverage that's going to be able to uh, take care of the majority of your expenses
Mm.
and not leave you with too much of a monetary expense. So you have that. So those are the three different periods that you have. Open enrollment. I'm sorry, there's also another one. I apologize. There's four. Then there's open enrollment, which runs from January 1st to March 31st. That only applies to those who have a Medicare Advantage plan. I can explain that later on. But if you have a Medicare Advantage plan, you can make moves from one plan to another plan in that time frame of January 1st to March 31st. So there's a like almost 6 months that you have that you can make some changes depending on what circumstances you're in.
Okay. So you were saying at 65, is there a penalty if you don't take
Oh yeah.
the plan? Could you
Oh
talk about that,
yeah.
please?
I can. Unfortunately, if you do not make when you have your initial election period come up, your 7 month period, whatever month your birthday is, 3 months before, 3 months after. If you do not make an election and have credible coverage through some other source, i.e., employer, the government will tax you, if you will, a penalty of 1% for every month that you're not on board until you get on board. Now, here's the kicker that penalty is for the rest of your life.
Oh, wow.
It never comes off. So, unfortunately, I've had clients who decided to come have a conversation with me 6 months after their election period ended. We got them in, but the government said, hey, here's another 1% on top of that you have to pay every year. And it doesn't go away.
Mm. Okay. So we talked about when we're supposed to enroll.
Yes,
So initially at 65,
yes,
if you're not working, if you get Part A automatically,
automatically.
automatically.
Hmm.
So if you're still working and you have credible insurance,
Yes,
you don't have to go on Part B
you
plan.
do not have to.
Okay, so we talked about Part A.
But let me interject something
Go
real quick.
right ahead.
Sometimes, though, and this is something that has to be considered by the individual, sometimes being eligible for Part B might be more beneficial because it could be less expensive than what you're currently paying for through your employer.
Hmm.
So if you're 65 years old and you're eligible for Part B, you might want to take a look at and consider the cost between what you are currently paying for your employer insurance, because that cost keeps rising every year, versus what might be available to you for you with Medicare.
Right. The more money in our pocket, the more
Yes,
happier we are.
absolutely.
So when do I enroll? We talked about a little bit of that. We talked
Hmm.
about the enrollment time.
Hmm.
So the specific times for us to enroll is like you see now.
So right now we are in what's called the annual election period, AEP. That starts in October 15th and runs through December 7th. So it's approximately about a 7.5 week period of time that you can make changes. Now, what this annual election period says is that everybody who is 65 or older can make their choices for their Medicare scenario. So, for example, if you want to do an Advantage plan versus a supplement, you can run in and out of them. The last application before January 1st is the one that counts for you. So then all of the applications taken right now are going to be effective for January 1st, 2026.
Okay, so what's the Advantage plan? We got A, B, was it C and D?
Yes.
Okay.
So
No E and F yet,
there's
right?
no E and F.
Okay.
So
make
E
sure.
and F and all the other letters are in the supplement. The Medicare Advantage plan is only A, B, D, and C.
Okay.
It sounds a little strange, but A, B, and D go together, and C is the three of them combined.
Oh, can you explain that, please?
Yes.
Thank you.
So Part A is your hospital, Part B is your doctors, Part D is your prescriptions, and C is all three of them combined. The three of them combined are what's called an Advantage, Medicare Advantage program. That's all three. Part A, Part B, Part D, all three of them combined into one is Part C. That's a Medicare Advantage plan. So when you hear people talk about the different parts, I know it can get confusing, but it shouldn't. Just think of it this way: A, B, C, D. Just flip the C and the D. C equals A, B, D. Did I say that too fast?
No.
A, B, D equals C.
Okay.
Part A, Part B is the hospitals and your doctors.
Uh-huh.
Part D is your prescription.
Okay. What about eye and hearing and your dental? What is that included in?
Those particular aspects of healthcare can be included in Medicare Advantage plans, depending on the type of plan that you have. When I say that, I mean, but depending on the company. All of them offer some sort of eye care. All of them offer some sort of hearing aid applications. All of them offer some sort of dental. The difference is between the companies themselves. One company may offer this, another company may offer that. Some have a stronger dental plan than others. Some have a stronger eye plan than others, so on and so forth. So it depends on the company that you're going to, will determine what sort of level of coverage that you're going to have. But yes, it includes dental. It includes hearing aids. It includes eyewear eyeglasses. There are plans that allow you to go see the doctor with no cost out of your pocket for regular checkups. There are other programs that want you to have a deductible. If you go into the hospital overnight, you have to pay a deductible before they actually pick up completely. So there are all different levels of types of coverage for the programs, but it all depends on the company that we're dealing with.
Okay. So we talked about what Medicare is,
Mm-hmm.
who can receive Medicare, the qualifications,
Mm-hmm.
who qualifies to receive it,
Mm-hmm.
when we enroll. Is there anything about how much it costs?
Yes.
Does that depend upon the person? Does it depend upon the age? Does it depend upon the plan?
All of the above.
Oh, wow.
So the plan is going to determine if there's a cost associated.
Okay.
For the most part, the base plans are zero premium. What I mean by that is nothing comes out of your pocket except for when you use it. So there's a difference between a Medicare Advantage plan and a supplement plan.
Okay.
Medicare Advantage plan, you pay nothing up front. You only pay as you use it. A Medicare supplement plan, you pay as you go, but then when you use it, you don't pay anything at all. So there's a big difference between the two. So in Medicare Advantage, usually zero premium, you come on the back end with what's called copays. We're all familiar with them because we had them at work. So if I go to a doctor, I pay $10 to go see my doctor. I pay $25 to go see my specialist. I pay some monies in order to receive the benefits of the plan.
Okay.
Medicare supplement, I don't do that. I pay a monthly premium somewhere in the neighborhood between $230 to $300 per month. Whether I go to the doctor or not, whether I go to the hospital or not, I'm paying that same premium every month. But when I go to the doctor, I don't have any additional costs associated. So those are the two different types of programs that exist. So for Medicare Advantage plans, some of them do have premiums attached to them. If you have a premium attached, it means you're going to have better benefits. The zero premium programs are great. They're good. But sometimes the premium programs have extra benefits that you can get for paying a little bit more. Somewhere in the neighborhood between $50 to $100 per month will get you better benefits than those zero premium programs that do exist right now. all of the companies have both zero premium and premium paying portions for their Medicare Advantage.
Okay. So, since you're the expert, can you tell us how we would enroll into the program? How do we decide what's best for us?
So there, normally, that would have been a really easy answer to that question. 2025, however, has proven itself to be extremely, shall we say, interesting. Normally, you would find a licensed agent like myself. We would discuss the different plans that are available, and we would sign you up. Insurance companies are doing something different this year,
Oh, wow.
much to the chagrin of every agent that is under the sound of my voice and across this country. So there are alternatives to dealing with an agent. You would have to call the 800 number, and you would be able to sign up with a program for them. They're trying to do some interesting things. I don't want to say all the things that they're trying to do on air,
Okay.
but they're trying to do some interesting things to kind of cut out the middleman, so to speak, which is unfortunate because a lot of people rely on our expertise in order to get the things that people need. As you said earlier, Medicare can be extremely confusing. And when you're talking to a faceless person on the other line who doesn't know who you are, who doesn't know anything about your life, it's really hard sometimes for them to give adequate and not just adequate, but appropriate information and inclinations or direction to what plan you should have. So I've always believed that the role of an agent is extremely important. But just to simplify the question, to give you a direct answer, you can see somebody like myself, and we can direct you in what direction to go into and to choose the right plan that might be most appropriate for you.
So, how can we contact you?
You can contact me in several ways. My email address is tbrooksjr at innovativeplanning.net. T Brooks Jr., TBROOKSJR at innovativeplanning.net. Or you can reach me at my office, 475-238-7088. I'm located at 250 State Street, Suite J1 in the city of North Haven, town of North Haven, Connecticut, 06473. I'd be more than happy to have conversations with anyone and everyone who has any questions regarding Medicare and the environment of Medicare.
Okay. So, that was a lot of information that we discussed. We discussed Medicare, how we enroll in Medicare, uh, Part A, B, C, and D. We discussed uh, how we enroll, Part A, B, C, D. We flipped the D and the C.
Yeah.
We discussed who benefits,
Right.
how long it takes for us if we're just initially turning 65 to begin our insurance coverage with Medicare.
Mhm.
The 7-month period, 3 months before, the month of, and 3 months after.
Yes.
Boy, I'm doing pretty good.
Yes.
Oh, I won't be an expert, but I do have a choice. I have when the time to enroll.
Right.
And it starts now from October
15th
15th through December 7th.
Yes.
We talked about the plan and the costs
Yes.
and how it affects each individual
Mhm.
individually.
Mhm.
It matters if you're on Medicare and Medicaid.
Right. So there's two separate sides, and Medicaid has the same requirements for enrollment that Medicare does. It used to be different, but they've changed the rules. So we have what's called the Centers of Medicaid Services. Testing. That allows us to where we get our rules from. So CMS, Center of Medicaid Services, they dictate to us the rules that we have to deal with every year. So and they dictate that to the companies dictate that to us. So for us to be able to be proficient at this, we have to take an exam every year to be certified. Not only just one exam, which is our AHIP exam, which is an overall, but we have to do one for each different company that we represent. Testing. So
Testing. So we're here live in the studio. Testing. I don't know what's going on right now. However, we're talking about Medicare Um, so all these different things that you have to be prepared for, that you
Yes.
have to study for, that qualifies you. It's we thank you so much
No,
for
it's
all
been
that you
been
do.
my pleasure. I enjoy this. I've been doing this now for 30 plus years. I know I don't look that old, but I am. But yeah, I've been doing this for 30 years, and it has been my honor, my privilege to be able to provide a service to my community in the greater New Haven and across the state of Connecticut. I have clients throughout the state of Connecticut and other states as well. So I'm licensed in the state of Connecticut. I'm licensed in New York. I'm licensed in New Jersey. I'm licensed in Massachusetts, Indiana, Texas, Tennessee, Florida. There's a few more out there that I don't remember, but I'm licensed in all those states. So basically, I have the opportunity to deal with people across the country. Many of my clients, when they leave Connecticut, they go to these other states. They still want to retain me
Mhm.
as Texas is another one. They want to retain me as their agent of record. So
Mhm.
I've been doing this for 30 plus years, and it's always a privilege for me to be able to help people and to bring information to folks who would otherwise not necessarily have access to it. And I think that's one of the biggest things and concerns for me in the course of my career is that
Mhm.
making sure that our community has access to this type of information. As you said earlier, it can be confusing, yes, but a lot of times confusion causes some of us to be stagnant and we don't do anything.
Correct.
And I think that's a problem because the government, well, specifically Medicare, will penalize you for doing nothing. You don't get. I've actually had a conversation with a gentleman who was close to 80, who had never signed up
Oh
for
wow.
anything. One, he didn't know.
Mhm.
And that comes because of the fact he wasn't born in this country, but he was eligible because he had spent so many years doing Social Security. But he was eligible for Medicare, but he didn't know how to go about it, so he just did nothing. So every time he went to the doctor, he paid out of pocket. But because he had spent so much time not in the system, it would jam him up to even try to get into the system.
Oh wow.
These are the sorts of things that I want to combat, and I want to be able to provide information for folks so that we all know and have an understanding of what's available for us. So I have many aspects. This is not the only aspect of my business. I have a few others as an overall financial planner, but this is one that's really important. I got involved in Medicare when my parents turned 65. Prior to that, I could care less. But when my mom and dad were getting ready to turn 65, I wanted to make sure that they were all set
Mhm.
for their health care. And so I became really, really involved with it. That was 15, 17 years ago now. And so I'm grateful to have had the opportunity to help not just my parents, but all my older aunts and uncles throughout time, and just people I come in contact with generally. Just wanting to be able to help them to the best of my ability and to give forth a service that would allow people to not only just benefit from, but flourish with, if that makes any sense.
It does make a lot of sense. You helped me
Yes.
because I was like, I don't know what in the world is going on, but I was ready to retire, and I said, I this is what I need to do, and you just happened to be an acquaintance that I've known for quite some time, and then you said, well, this is what I do. I said, okay, come by, sit down, talk, and
Mhm.
this is what we did. And even though he still have guided me and directed me, I just wanted to bring him here to discuss what goes on with the Medicare
Yes.
because we don't know. For years, we've been working. We just went to the job. Well, this is the plan that we have. You choose a better
Mhm.
job. Please, your job, you choose the better plan.
Right.
Whatever one benefits you the best. Medicare is kind of like toss of the hat. You find out which one that works best for you. They guide you through. You choose it. But if you don't choose it, you're going to be in trouble
Yeah.
because if you get sick, you have no insurance.
Right.
So we want to make sure that we enroll. Ted, please give us your information once again
I certainly
where we
will.
can reach you if we have some questions that we need to ask you
Okay.
regarding Medicare.
My telephone number for the office is 475-238-7088. My email address is tbrooksjr, TBROOKSJR @innovativeplanning.net. And my office address is 250 State Street, Suite J1, North Haven, Connecticut, 06473. Please give me a call. We can schedule an appointment, sit down and talk. Just to let it be known, I don't charge a fee for what I do. So if you want to have a conversation with me, for this specific area, I don't charge a fee. I would gladly have any conversation that you need, answer any questions you need answering. Again, I want to make sure that I am helpful to the best of my abilities. Now, my last thing before we leave.
Uh-huh.
Notice how I didn't say any insurance names and the companies?
Correct.
That was purposeful. Let's find a company that works for you. They all have something different. But I don't want to spread out any kind of names and give specific examples because I don't know what's going to work for you. But when we sit down and talk, I will show you 3 or 4 different companies that you can have a choice from, if not more, that be able to help whatever situation that you're currently.
Okay, so Ted Brooks Jr. will discuss the best Medicare plan for you. So
Absolutely.
thank you so much
Thank you.
for sharing your expertise on Medicare today.
Yes, ma'am.
Thank you for informing our community and our audience
Yes.
about Medicare. It's a pleasure having you here with us today
Thank you.
on Word Out
Anytime.
Ministry.
Anytime.
Thank you so much, our audience, for tuning in, and we'll look forward to seeing you again next week. Remember, you can call Ted Brooks Jr. at what number?
475-238-7088.
And he'll discuss the Medicare plan that's best for you. Thank you. Have a great day.